This month we're talking chronic pain and fibromyalgia in particular. Now, to understand chronic pain, you first of all have to understand pain. So, what is pain? By definition, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Now, what does that mean? Okay. In a nutshell, that means that we can experience pain without any injury or real damage, and we can have a lot of damage and not experience pain. Now, that goes against everything I used to think about pain and everything I once thought, where if I was sore, there must be something wrong, there must be something damaged, there must be something injured, but that's not the case. Us as chiropractors and the medical profession as a whole, we often use the term nociception when describing pain. Now, nociception is our alarm system. It translates to danger signal. Now, if I was to stand on a short stone, it would be nociception which travelled up from that injury, up my leg, to my spinal cord, and often up to my brain, where my brain would determine how much danger it thought it was in, and it would create the pain that it saw fit. Now, nociception and the amount of nociception doesn't determine how sore something is, and the amount of pain you feel isn't a correct representation of the amount of nociception. Now, pretty complicated. However, most of us feel nociception all day, every day. For example, you're likely feeling nociception coming from your feet or your bum, depending on whether you're sitting or standing watching this video. However, we're not in pain as we do that. So how does that all contribute to chronic pain as a whole and conditions like fibromyalgia? Well, with chronic pain and fibromyalgia, our brain becomes hypersensitized. Not just our brain, but our central nervous system as a whole. And what this means is nociception from everyday exercises, everyday light touch, everyday activities like sitting and standing becomes too much for our brain, and our brain interprets that as a danger and a threat and creates a pain response when it shouldn't be doing that. Okay, the tolerance level for our pain has lowered so that things like light touch and exercise, a lot of the complaints fibromyalgia patients explain and complain about, are enough to cause pain. Now, although your brain determines how sore things are 100% of the time with no exceptions, it does not mean that pain's not real. Okay, the pain is very real.